Hi everybody, welcome back. We are the Hearing and Balance Doctors. I'm Dr. Ryan Whitaker here with my partner Dr. Rich Luekenga. We've got another exciting ear-related topic to talk with you about today. We want to talk about issues that are comorbid with hearing loss. Now that's kind of a strange word. A comorbidity is a condition that goes hand in hand with hearing loss. And there are 6 issues that often go hand in hand with hearing loss.
Well, let's get right into it. We're going to talk about 2 quick ones. The first one might be kind of obvious: cardiovascular disease, or issues with your heart, issue with your vascular or your vein, your venation throughout your body. And so what happens with these small organs is that when you're not receiving the proper nutrition, the proper flow of blood, and everything that comes with the blood, it really does affect small organs like your eyes, and certainly your ears. And so your hearing, your balance, some of these things can really be compromised. And speaking of balance, that's another one where your vestibular system or your balance organ will also be compromised when it's related to blood flow and things like that. If you feel that you're having an issue with equilibrium or balance problems or even just dizziness in the head, you might want to have your hearing checked as well. And so that's one of the things that goes hand in hand with hearing loss is balance problems. And certainly if you know that you're treating your heart with medication and you have some form of heart disease at all, probably a good time to have a baseline hearing test done for sure.
So those are the first 2 comorbidities: cardiovascular disease and balance issues or falls. The next 2, number 3, is loneliness.
That sounds sad.
And it does sound sad, and kind of going along with that, number 4 is depression. So those 2 things are often linked, that sometimes when people lose their hearing a little bit, it causes them to be more isolated. They don't feel part of the group. They don't feel part of the conversation. And that can lead to things like depression. So those things often go hand in hand with hearing loss as well.
Sure. And one that gets a lot of attention in the media and gets a lot of attention in just even here locally, in different journals or even in the newspaper, or people are sending out direct mail pieces trying to educate the public about the effects that the brain and the effects that the hearing loss has on the brain. And so if you're starting to find that your loved one, or maybe you yourself, are feeling like I'm becoming more and more forgetful, probably a good idea to have your hearing checked and have that looked at to make sure that there's not a strong relationship there. But oftentimes when people are feeling some dementia and just the beginnings of that, we're probably a good idea to have the hearing checked and have that looked at. Another one of the D's, we talked about dementia, and we talk about depression and loneliness, but another one of these D's is diabetes. Diabetes can be a big one too.
That's number 6. If you have any of these issues, cardiovascular disease, loneliness, depression, balance issues or falls, dementia, diabetes, we recommend that it's a good idea to get your hearing checked. These 6 things are red flags. They're risk factors that you may also have hearing loss. And so our take-home message today is, if you have any of these conditions, it's a good idea to come in and get a baseline hearing test.
Right. Be proactive. Luckily, the hearing tests we do, these comprehensive evaluations that look at your hearing and look at how your hearing is affecting your brain, these tests are covered by insurance. And so that's really nice. Almost all the insurance forms that we see, we take them here, we accept them, and so it shouldn't be a big deal. So come on in. We'd love to do a baseline test and see how you're doing.